Hi, I'm Alexa Dahl.
Hi, I'm Madison Ward, and we're doing our presentation on gestational diabetes. So, what is gestational diabetes? Gestational diabetes is an extremely common disease found in about 2 to 10% of women that are pregnant in the US. This disease can develop in women that do not already have diabetes due to the vast changes that are occurring in their bodies due to their pregnancy. And these changes can create an increase in insulin resistance while the body is already struggling to make insulin through pregnancy. So, thankfully, this disease does go away post birth, and there are ways to avoid getting it again with a possible future pregnancy. And there's also ways to avoid developing type 2 diabetes later on in life as well. For the diagnosis and symptoms, there's usually not a lot of them. There's only a few, which is nausea, fatigue, and blurred vision. And for the diagnosis, all pregnant women have to be tested for gestational diabetes. This is just done simply through a glucose tolerance test. The mother is asked to drink 75 grams of a sugary solution. Then about an hour or two after, blood samples are taken to see what the glucose levels are. And then also for diagnosis, usually if it runs in the family, then you're most likely gonna develop this disease while you're pregnant. The main goal of treatment is simply just to keep the baby from getting too big, just because that can cause injury to the mother and to the baby. And also, it's important to change your diet to focus on eating fruits and vegetables, whole grains, low-fat foods, and to avoid high sugar foods. And then you're also going to want to monitor your blood sugar levels, and also you might be asked to have insulin injections or even take oral medication to help. Some risks are the mother can have an increase in risk of preeclampsia, possible labor problems. Most women that have gestational diabetes have to have C-sections because the baby is usually on the larger side and they don't want to cause injury or harm to the mother or baby through a vaginal birth. And then also some risks is the child could also develop diabetes and the mom can develop gestational diabetes again or type 2 diabetes later on in life. Can gestational diabetes be cured? There's no general cure for it. It usually just goes away after birth, but the chances of developing it again in future pregnancies does increase, as well as type 2 diabetes, as I said earlier. Diabetes treatment should and will continue after pregnancy to ensure optimal health for the mom and the prevention of developing that same form of diabetes again in the future. Proper nutrition, exercise, and insulin injections are recommended as a way to avoid developing this disease again. Nutrition just looks like increasing fruit and vegetable intake, consuming enough daily protein, and having healthy carbs and fats incorporated into the diet. Exercise options can be walking or weightlifting that help the mom avoid developing this, and insulin injections also may be needed to manage blood glucose levels.
Future options to cure gestational diabetes include advanced genetic research, investigating genetic factors contributing to gestational diabetes, target specific genes or pathways for potential treatments. This is very treatment and also like trial based currently, and isn't regularly practiced with pregnant women just because they don't know the full effects it has on the babies quite yet. But in the future, it will hopefully be a little bit more developed for the mothers to prevent diabetes. And then innovative therapies, the development of naval medications targeting insulin resistance or beta cell function, that has to do more with the baby than the mother. And then the exploration of hormone-based therapies to regulate blood sugar levels during pregnancy can also be helpful as well. Again, it's not as commonly practiced as just using insulin to regulate the blood sugar. Personalized medicine approaches, tailoring treatments based on the individual's risk factors and genetic profiles kind of goes along with the genetic research. Uh, Researchers have studied genetic profiles and then they're able to make treatments based on that specific genetic profile. And so for women who have gestational diabetes in their first pregnancies, they are at a lesser risk of developing it in their second or third pregnancies with the tailoring of treatments. We also are using stem cell research and the potential of regenerative medicine to offer new avenues for GDM treatment. This one isn't as commonly used and is very much in the early stages of being developed, but again, hopefully will be a future option to curing gestational diabetes. Lifestyle interventions, digital health technologies is a new one that can personalize diets and exercise plans, which goes along with treatments that are already used for gestational diabetes. It's just improving them and making them more available to moms while they are at home rather than visiting a doctor's office. Collaboration with researchers, policymakers, and advance GDM research and treatment. And all these people are working together to treat gestational diabetes and to advance the treatments for them. In lab on Monday, we ran multiple tests on blood and urine samples in order to detect the presence of sugar in both samples. We were assigned patient 1, which presented with a glucose level of 500 milligrams in both their urine and their blood samples. We tested these through Benedict's solution procedure, Clinexis strips procedure, the glucose meter, as well as the dipstick procedure. A normal range for blood sugar should be under 130. This patient obviously has over 130. You're diagnosed with diabetes if your blood sugar is consistently over 200. So a blood glucose level of 500 is significantly more than 200 and can cause liver failure, which is why ketones were found to be in our patients' urine samples, which again coincides with liver failure. To conclude, gestational diabetes is a condition that can be managed and can be resolved after pregnancy. A healthy lifestyle has shown to help prevent the development of gestational diabetes as well as type 2 diabetes after the end of the mother's pregnancies. Nutrition and exercise are key factors in a healthy lifestyle, as well as just being able to manage your blood sugar levels during pregnancy helps with future pregnancies as well.
And these are our references. Thank you for listening.